was to review the pelvic clock as titled in the document you received as a handout. You'll see here that a demonstration will tilt the pelvis backwards towards the chin, flattening the back. The tilt towards the chin is considered 12 o'clock. We do not want to put pressure in the heels or the neck while working this. The specific muscle you will feel is the rectus abdominis. It should be in the front of your abdomen. And you just hold gently for a 10 count. Then we will travel into the 6 o'clock position, where we picture the 6 o'clock between the heels, so the back will arch and the pelvis will tilt forward. The majority of this motion should come from the pelvis. Once again, not from your neck or upper back. It should be a gentle tilt with a small curve in the back. Do not move too excessively, as you will see right here where she raises up and then lowers back down. Once again, this will work the multifidi, or tilting the pelvis towards the heels. So we get a gentle arch forward. Also call this the mouse house effect. Pretend the mouse is running under your back. And then what we don't want is that excessive motion, which you will see right there. That is way too much motion. We want to focus on the pelvic motion and the control of the multifidi, and as well as the rectus abdominis. Next is the 3 and 9 o'clock position. 9 o'clock would be to the right, 3 o'clock would be to the left, as the dial of a clock. You will see in this position that the right pelvis raises and the left pelvis lowers down. Note, this is not a hip hike, this is a rotation. The left side goes down into the table, the right side comes up to the ceiling. You will now see the 9 o'clock position where the right pelvis drops and the left side raises, rotating in the opposite direction. Please be sure not to hike your hip. You do not want to feel a side tension or side bending motion. So you will see her hip rise on the right. That is an inappropriate motion. And then you will see her hip rise on the left. Right there. That is an inappropriate motion. Those are the wrong muscles. We always want to use it as a rotation. Keep in mind, you will do a 12 and 6 o'clock at 10-second holds each, and then a 3 and 9 o'clock at 10-second holds each. If you are unable to maintain one direction, you can always go into the opposite direction and hold for 60 seconds. Then return back to the harder direction. You should notice an improved motion and a better sustained hold, and potentially even less pain.